Colin has an outpatient appointment at the hospital today where Mariam works as a nurse. They both rely on the bus to get them there. To provide them with a good service, a whole team of people must work together to design efficient routes, keep buses working and make sure they have enough drivers. But sometimes buses are early and sometimes they are late. There is also variation in demand, meaning there might be more passengers at certain times or on certain routes. The healthcare system faces similar challenges. It is normal for demand for a service to change through the year. Sometimes this will mean the demand for a service exceeds capacity. So how do we plan better for variation in demand? If we compare recent demand data against our staffing resources for the same time period, we can model future demand and anticipate system pressures before they arise. This is demand and capacity planning, and it's more than just a data exercise. Demand and capacity models help us visualise a service's performance and the likelihood that it will meet patient demand, meaning Colin won't have to wait for treatment any longer than necessary. With good data, demand and capacity models help visualise how a service is performing and how likely it is to meet the demand from patients. Ensuring you have the data to input into the models can be time-consuming, but how do you know otherwise if you are planning to use your resources efficiently? Let's look at how demand and capacity planning can help you. For providers, when operational, clinical and informatics staff come together and commit to demand and capacity planning, the resulting improvements can benefit patients, staff and taxpayers. Input from consultants ensures patient-centred pathways, and booking staff, ward clerks and receptionists learn more about what changes they can implement in order to make things work more smoothly. Better evidence also helps trust finance directors decide how to allocate resources strategically. This minimises costly waiting list initiatives and agency work and ensures planning accommodates realistic demand for services. As with buses, making health services effective and efficient requires mapping out the system. For chief operating officers, demand and capacity is a large but invaluable undertaking. Once mapped, trusts can redesign service pathways based on demand and capacity models in order to maximise resources. And as the trust's capacity begins accounting for variation in patient demand, Colin's experience as a patient will improve. This is also true in the complex contexts of community and mental health services. In these cases, patients can require treatment and care for a longer period of time, so understanding how their needs change is crucial to providing good care. So demand and capacity planning in community and mental health services requires a more sophisticated model, but the underlying methodology still works to help create a clearer picture of the service. There are similar challenges in data collection and reliability, but investing the time will significantly benefit patients and staff. And without sufficient demand and capacity planning, experience shows patient lists will grow longer, which can affect clinical outcomes. Commissioners also have a responsibility for this. With a good understanding of demand and capacity, commissioners can take a strategic view of the local health system, then work with providers to make evidence-based plans and promote existing best practices. They can also ask the right questions at assurance meetings to ensure providers make the most of their demand and capacity planning. Then they can be more confident that providers will meet their targets and patients will receive the care they need. Demand and capacity work does require an initial investment of time and resources, but the improvements to care and efficiency have been shown to make a real difference to patients. Your first plan might not be perfect, but it will improve with every iteration, and going through the process together will generate dialogue and trust across different services and departments. Commissioners will better understand providers, administrators will better understand clinicians, and so on. Redesigned pathways will work more efficiently and staff will feel empowered to act when problems arise. And your wait lists will become sustainable. Learn more about demand and capacity planning with the resource pack available as part of the Joint National Demand and Capacity Programme, and help Colin on his way.